I just want to welcome everybody to the third annual Open Data Fest. So we're delighted to be here once again to report and to share with you learning about what's going to be happening over the next couple of days here. It's got a really exciting program from across the state. We'll have representatives and actually across the nation. So what we're going to do here is, and we're just going to open it up a little bit here. I'm going to ask Andy to welcome us, and then Mike, and then I'm going to come back and help sort of present and orient us to what the proceedings will be for the day. So with that, Andy. Yes. Oh.
Okay. Hey everyone. Are we working? Hello. Oh yeah, you can hear me now? You can? Okay, okay. There we go. Well, I was just talking to you, Stu, anyway. I wanted to start off with a little story, in essence, that to me just resonated in terms of, I guess, the impact of what we're all doing. A couple of weeks ago, I joined my colleagues, my open data colleagues here at the state, on a tour of Fresno. This is us on the tour. In essence, what we wanted to do is we wanted to see how we could humanize the data, you know, the conditions that we see in the data, what it could represent, what does it mean. And this tour really gave me sort of a new perspective on how we're all trying to leverage data to achieve some kind of social impact. So we started this tour in the 41 and North corridor, which is situated between a Cargill meat processing factory and a freeway, Highway 41. And so as you can imagine, you get a lot of lots that look like this. This is where the kids would play. And what was really gratifying for us to see is that this particular lot, this exact lot, is now this. It's a park, you know, which if you're in a community like the 41 and North Corridor is a big deal. But what was really amazing to me is the role that data actually played in this transformation. And you might expect that they use sort of the garden variety indicators that we as health professionals perhaps think a lot about, mortality rates, environmental dangers. And the 41 and North Corridor absolutely ranks probably among the worst, certainly in the Fresno area, and I bet it would probably be among the lowest in the state if you were to look at that. But what was amazing is that they actually grew, and I say that term actually purposely, they sort of homebrewed their own data to sway sort of reluctant elected officials who didn't really want to pay for maintenance on a park. So what I mean, for example, is you have kids drawing pictures. They did this at a neighborhood event, kids drawing pictures of parks. And then Habitat for Humanity took those pictures, coded them, number of slides, et cetera, and turned them into data. And teenagers also went door to door to conduct homeowners assessments. And these data, coupled with stories, and that's, I think, an important piece, they coupled the data with stories, were harnessed to help make the case and to see the effect that you witnessed and you saw right there. And I think it's maybe useful for us just to take a moment to reflect on that for a second. Organically generated data plus stories made the case for what really amounted to a pretty major neighborhood improvement. And so here we are, third Open Data Fest, and I think it's a really good time to reflect on use cases like this and kind of just overall to assess where we're at. I think we have made enormous strides since the first Open Data Fest, in essence 2 years ago, but January 2014. I think there are something like 150 data sets now live on the portal. Mike and his colleagues deserve so much credit for that. Tremendous collaboration between the state and the communities that are using these data. It's been wonderful to see. An agency innovation office that's blossoming. It's really, quite honestly, staggering to mark the progress. But I also kind of wonder if we need to think about potentially recharacterizing what open data means, what open data is. Less defined, perhaps, by the number of apps created, the number of data sets launched, and more by the number of communities, like the 41 and North Corridor, that have been empowered. It's about making perhaps wiser policy decisions with data and elevating public discourse, using facts and measures that really resonate with all of us. And I think doing that is going to mean that we have to be a little creative in ways that we perhaps haven't been, such as encouraging communities to grow their own data, and knowing that there is real power to that if you can couple it with stories, if you can couple it with the indicators that someone like the state or the local health department are releasing. And I think what I've come to the realization of is that really what's needed perhaps falls less on government's shoulders and more on the shoulders of all of us. And I don't mean to downplay the role of government in this. I think it is such a key role that government plays with opening up their data, with open data. They publish data, and they publish data in accessible formats. And they, in essence, by doing so, are starting a conversation. They're catalyzing a conversation using data. But I really believe the rest of us need to take it from there. We need to use data in ways like they're doing in Fresno. And I really hope that at this event, we can have these kinds of conversations over the next 2 days and carry them forward from there. What does a partnership between the government and communities like the 41 and North Corridor, what should that look like? What do we think? And I think the agenda that we've sort of set up today with plenty of time for interactive sessions and such, it's going to set us up nicely to have these kinds of conversations, whether it's by what's happening here on stage or what you guys are going to be doing at your tables. And I really appreciate sort of all the work that Stewards of Change have done to put this event together, the nice agenda, put it together, and all the work that the health agency's done, in essence, to own this event and to take it on. So, I think it's really good now. Let's start having these conversations about what we can do to make places like the 41 and North Corridor, because there are tons of these places around our state. What can we do using data to help them all make community improvements? So with that, I'm turning it over to Mike. Sure.
Great. Well, thank you, and good morning, and welcome to the third annual Open Data Fest. I'm happy to see so many people here representing government and all levels. We have federal, state, local, academia, and the private sector. I'd also like to thank our sponsors, and especially CHCF and the partnership that we've had with Andy that's making this event possible. The Stewards of Change for organizing the event, which they always do a wonderful job putting on a very interactive event. And all of you for your continued engagement with open data. Over the next 2 days, you're going to hear presentations from those on the cutting edge of open data. You'll participate in activities designed to hone your skills, expand your thinking about what is possible. But I'm particularly excited we've been able to expand our focus and the focus of this event by partnering with local governments and academic institutions, and you're going to hear a lot more about that over the next 2 days. As many of you know from prior discussions and prior presentations by me, I was not an immediate embracer of open data. You also know that I've struggled with the question of to what end. So I'm going to give you a little update on that. Over the course of the last 2 years, I've come to view open data as an entry point. It's a relatively low-cost, low-risk way to start talking about how an organization shares and uses data. But it has the potential to be much more than that. It's a way to start thinking about how you interact with customers and stakeholders. It's a starting point for discussing how to better utilize data internally, an opportunity to rededicate the focus of your programs to focus on those who are receiving the services, a place to start conversations about creating a more engaging and rewarding work environment for your staff, a chance to change how you do business. It's the entryway to cultural change. So in my mind, it's really shifting. It's not really about the data. It's about an opportunity to change the culture of your departments, create a work environment that encourages staff to better utilize data to improve programs, about creating more efficient programs focused on the people that are receiving services. That is why I'm committed to this effort. That's the answer to what end. So I encourage you to think of the greater possibilities as you engage in the discussions and activities across the next 2 days. And I think you're going to find this to be a very rewarding experience. Thank you.
Thanks, Mike. Thanks, Andy. So we've got an ambitious agenda. I think Mike already talked a little bit about it, but the goals that we have set for ourselves in planning this is to really share progress, celebrate some of the accomplishments that have happened, and make some new connections. There are a lot of new people here in the room that have not been to one of these events. In fact, let me see a show of hands of people who have not been to an open data event yet. So great, there's a lot of new people, so it's a great opportunity to really share ideas and get to know people. It's really a lot about making some new connections. We're also looking at connecting this concept of social determinants of health and wellness with Let's Get Healthy California and with open data. So while we're starting with open data, we're looking at how this really affects the larger health and wellness of our state, our community, individuals out there, and we'll hear more about those concepts and how they link together, how we build from that. We want to showcase some innovative local, state, and national programs. We'll be hearing about some of those things. And we're going to explore a little later this morning the intersection between academic research and open data. And it's kind of a new area to think about. We all live in our data silos or our program silos, and the same concept applies to data in many ways. And so we had the opportunity a number of weeks ago to have a similar one-day conference at Stanford and really raise that topic. And we're going to come back and talk about that in some greater depth and then be able to have some chance to reflect on that. We want to bring together various agencies involved with open data to learn from one another and to avoid building more data silos. And I think that from a state perspective, that's really exciting. With all the work that's gone on in Health and Human Services, which is fabulous and very extensive, there's a similar effort going on in other programs across the state. And really thinking carefully about how those things link together will be important. Our role, your role, will be helping to actually prepare some recommendations about what do we do next. Right? So every year we've done this, we've actually gone through an exercise, talked about some of the challenges and opportunities and reflected that back to the state. And I think we've seen a lot of things that have happened over the years, at least in alignment with a lot of the feedback that we've gotten over the last couple of years. So one of the things we'll do is we've structured this in a way that will help you learn, think, process, so that when we get to the interactive sessions at the end of the day tomorrow, we'll be able to really bring forward some really clear, precise ideas about what do we need to do next, both on a national or on a state level and a local level. And then importantly, we want to introduce some concepts and tools and methods to advance information sharing and interoperability. As Mike said earlier, this is some people affectionately refer to it as the gateway drug into research and linked data, and we're thinking about that in so much the same way of how do we really help connect our systems all together through data and through other efforts. And so we'll be sharing with you some ideas that we've been doing as an organization and the state's been doing in terms of using that to really create closer common connections between programs and being able to share that information. So. Just a quick chart on where we were and where we are today. So we started, affectionately referred to it as the data prison, previously before the Free the Data movement occurred. And now there's lots of data that are free. We started with no data portal, and now we have a statewide HHS portal with 164 data sets, representing, I think, all 12 departments. And that's a tremendous accomplishment in a very short period of time. There were very few, or if any, regional or community-based open data events. Now they're happening with some regularity across the counties and the cities across the state. There were no statewide convenings to bring people together to talk about this, and now we're at the third Data Fest, which is terrific. There was no data innovation focus in HHS, I would say, and now there's an actual innovation office, and we'll hear a little bit more about that. I think California was slightly late to the game, and now I think by all accounts, California is leading the open data effort across the country, which is just a great place to be. So there's actually a lot more material from the last year's event that we did a pretty thorough review of it, and that will be made available for folks who want to look at it more closely. And we've distilled from that and also from the Stanford event some materials that we'll be looking at later this morning. And now for
where I would start on the value proposition of open data is it really has an enormous opportunity to improve quality of life for individuals.
I think there's been this really growing paradigm shift in health, not just healthcare, but health and well-being. And a lot of that is from the social determinants.
This conference has tremendous value for local health departments because, as you know, they are the keepers of many data, collectors and keepers of many data. And with open data platforms and some of the innovative things we're learning here, we can help them really harvest that data to the advantage of the public's good.
If you think about the sort of early computerization type things, it was about taking data and creating information. What we're doing now is taking information and creating knowledge.
I think events like these really help inspire all of us, to see the change that's being made, and also just the possibilities.
The goal of this website really is to start to engage people. Let's Get Healthy California is a start toward helping people align their priorities.
It's really impacting the culture of CHHS, of a 30,000 person workforce, how we look at our data and how we provide services to our clients.
What California has done with its open data portal is really advance it to the next level. They've democratized more important data sets and made more usable tools in a short amount of time than anyone else. They're setting the national standard.
We're all going to need to help build this health data village. It's going to take all of us, inside government, outside of government, et cetera.
We see just a wide variety of people here engaging in open data discussions. We want all of those people to then take it to the next level and contribute, build apps, submit ideas, and make it better, make it more of an ecosystem than simply an instance of open data.
Amazing what a few pictures can do. We've covered a lot of territory over the last couple of years, and this is just a little reflection of some of the thinking, some of the people, some of the ideas that were available. Just a note for those of you who have interest in learning by video, we have all of the videos from last year posted on our YouTube channel. There's some great presentations, and the work from these 2 days are being videoed, really to make them available more broadly for yourselves and for your staff as you go back. And hopefully we'll be able to turn this into almost a curriculum of sorts that will be available across the state for people as we continue to promote this. One of the things, this is very kind of California focused, one of the things that we've just recently seen here is a parallel effort on the national basis, right? So this just came out. I think probably everybody heard that President Obama was at South by Southwest, or is probably even still there as we're speaking. That's why he's not here, but we try. But they announced a project, Opportunity Project, which is utilizing open data to build stronger ladders of opportunities for all. You have a copy of this in your packets. There's a couple of pages in there that I'll mention briefly. This was really exciting. This came out last week. And what I wanted to call to your attention is that the federal administration is releasing, and they say here on the bottom, is releasing a unique package of federal and local data sets in an easy-to-use format, and accelerating a new way for federal government to collaborate with local leaders, technologists, and community members to use data and technology to tackle inequities and strengthen their communities. So we're part of a larger ecosystem that's at a federal level that's really driving this and continuing to push this work going forward, which I think is really, really quite exciting. And tomorrow, Damon Davis from Health and Human Services will be talking more about this from HHS and other stuff that's going on at the federal level. The other thing that you have in your packet is this announcement from the Administration for Children and Families, which is talking about interoperability at ACF, and how does the federal administration promote information sharing. And there's a renewed effort that's now coming out. This is just a couple weeks ago that this came out. And so I think this work also, as I was saying earlier, connects with a lot of the work that we're doing here. Open data is a way into this conversation, into data-driven decision-making, into connecting systems, into interoperability, and as we'll hear about a little bit more, interoptimability. So what do we do with all this information when we bring it together? Again, I also want to thank our sponsors who have helped put this on. We got a tremendous amount of support and encouragement from CHHS. Also, California Healthcare Foundation has been a stalwart supporter of this work, not only helping put these events on, but other work across the state that is really, really hugely relevant for making this work. California Endowment, Blue Shield of California, kidsdata.org, Stanford hosted the last event, as I said previously, and then IBM is also one of our corporate sponsors here.